I'm Lyle Hanna. I'm just delighted so many of you are joining us today. You know what? It gave us great joy to put out breaking news, since that's all you ever hear anymore. And it actually broke on Wednesday. But the cool thing is that Jim predicted it a week ago. We knew something was coming, and too many things had come together to make it so that the governor was going to need to do something. And we just thought it was good to clarify some of that stuff. And so that's why we called this meeting today. This won't go on as long as other weeks. We suspect if you have questions, we'll go as long as we need to. But I like it when people speak up. You heard John Green from Keeneland talking there, and Brad Patrick and others. And so if you want to hang around at the end, we open the mics and give people a chance to speak up then. So let's get it rolling. The only thing on the agenda today is what's going on in Kentucky. And Jim Morris has been all over that all weekend, working on it, getting the up to date. So Jim, take it away.
All right. So based upon what's going on, one thing I think we need to be upfront about is there is no credit for this through SHRM. This is literally a legal update, half an hour plus questions if we have any. So this was done on the spur of the moment, no time to be able to submit, and no additional discussion points. Literally, this is to help you all get through this. Last Monday, we talked about the fact that the Supreme Court of Kentucky had ruled the week before. In essence, the Supreme Court ruled that during an emergency, the governor is in fact equivalent to an emperor. He gets to make the rules, he gets to enforce the rules, he gets to interpret the rules, and shame on the legislature for doing what they did and giving him those powers during an emergency. A little bit frustrated with the Supreme Court. We'll get into that in a minute, because some of these things that I see happening are their fault. So I'm going to blame them. I'm going to tell you what I feel. So 2 orders were issued on Wednesday. Those 2 orders are a result of the critical issues going on in Kentucky. So let me walk you through some background really, really quick. I won't waste time on it. This was November 2nd. Now the color changed because they realized, and I'd raised this issue to them, they realized that they had called things critical. If you look, I'm going to put my highlighter on. This is, again, I just want you to understand, this is November 2nd, 2020. This color here was supposed to be red because they called them red zones, but they were orange and orange, so it was difficult to talk about, difficult to know what they were meaning. So they changed the color. So pay attention to this dark orange and look at what happened last week. So this is as of November 14th. So 10 days ago, roughly, 9 days ago. You see the difference between this one, whoops, forget the fact that it turns red, but there's quite a bit of difference between that and this. Menifee is the only yellow, which is community spread. The rest of these are in the critical zone or accelerated. You had about 95 red, and the rest, looking at, there's 120 counties. Yes, I know that. So you're looking at about 20, 25 counties. Actually, it looks like about 15 to me, so about 105. The next one's really easy to count. Troy made a comment, we only need a red crayon. This is this morning. 3 counties are orange, the rest are red, so the entire state's red. Based upon that information, the governor believed he had to act. This is the White House last week. We don't have this week. Last week when I presented on the 15th, we didn't have the 15th yet. It was stable. There was not community spread. They were saying it was flatlined. Now the quote is from the the White House Corona Task Force. There is now aggressive, unrelenting, expanding, broad community spread. That's the quote of the day, and that's used by our governor in his orders that you're going to see here in a minute. They continue in the red zone. 344 cases. I'm not going to go over what it was before. We're the 24th highest rate, but that's because the rest of the country is exploding. We're in the red zone for test positivity. We were in orange last week. Seen an increase in new cases. Keep in mind, this is a week old. We get the new one out today. I expect it's going to be drastically worse, but this is what led to the decision, okay? 89% of all counties have moderate or high. Between the 7th and the 13th, 307 confirmed new patients per day. 95% of hospitals had a confirmed new case, not going through the nursing homes, but you see the trends going the wrong way. The red zone reduction recommendations. This is hard to find on the page, so if you have any of this you need for your companies, feel free to copy it off of here. But this is hard to find on our KY COVID-19. It's kind of buried, so I want to put it back on there. This is what you're required to do in any county that is red. In other words, if you're not in Menifee, Rockcastle, or, sorry, that's Nicholas? No, to write a Nicholas Robertson. I'm sorry, I can't read it. And if you're not in those 3 counties, you know you're in the red zone. That's this red zone reduction. You're required to allow your employees to work from home. Non-critical government offices work only virtually, reduce in-person shopping, order takeout. Some of these don't even apply because of the order that you're getting ready to see. But you need to reschedule, postpone, or cancel public and private events. Don't host anything. Avoid non-essential activities and reduce your overall activities and contacts. Follow existing guidelines. All right, the executive orders, there are 2. I have them in totality. They have been hard to find. They are now easier to find because they are on the KY COVID. For a while, they were not. So I'm going to put them in the chat for anybody who needs to copy this and get it anywhere else. This is the one affecting businesses. Sorry, I'm looking away from the screen, but I have multiple screens here. This is the one affecting schools. Okay, so you have 2 different executive orders. We're going to talk about each of those. So 2020-968 was issued on the same exact date last Wednesday. The effect is this: restaurants and bars. Sorry, my laser pointer's gone. Whoops, I don't know why it's gone. But restaurants and bars, I can't get the pointer to work, so we're just going to roll with it. There we go. Restaurants and bars. Cease all indoor activities. You're restricted to 3 things: delivery, to-go orders, and outdoor. Concerned with outdoor, I talked a little bit this weekend. I'm trying to support the local businesses, so I did go out. There's a list that's circulating, at least in Lexington, of those that are offering outdoor eating. Limited to 2 households, 6 feet apart, no more than 8 people. I went this weekend. The concern I have is now what we have is an outdoor tent, all sides closed, with a heat box blowing in, or a heater blowing in. To me, that's less safe than a air handling system in a regular, good, well-run restaurant. So now what we're doing is we're forcing people to go outside into what Lyle said this weekend. I don't think he'll be upset with me saying this. So basically what you just described is a hot box of COVID. And I said, yeah, that's my fear. That's my concern. Outdoors not defined. I hope that the governor's office is going to address what that means, because right now you close the sides on a tent, and now you're doing outdoor. I could see this going beyond just restaurants to other facilities, other businesses. Hey, we're just outside, but they're not really outside. They're closing the walls in. The other thing is, the one I went to had 2 garage doors that opened. We were sitting in it. They sat us in a bar location. There's no way some of those people were close enough to a garage door to be outside, but they're calling it that. So that's the restaurant and bar shutdown order. I expect we're going to see some clarification, because those are not good enough to have outdoor hot boxes of COVID. Social gatherings. This is where we get into some of the things that are impacting indoor at your own Thanksgiving gathering. You cannot have more than 2 households. You cannot have more than 8 people. They have not identified what they're going to do. I have a neighbor who has 12 people that live together in one house. That's how this was declared unconstitutional starting in May.
I have stage 4 cancer.
I suspect that that will be addressed as well, because you can't have a limitation on a family that can't get together when they have more than 8 people in their household. But that is the limitation. Yes, that does apply at your house. Yes, under the current emergency orders and the Supreme Court, our governor has the ability to direct how you handle things in your own house. I believe that'll be subject to challenge if it is enforced, but the Supreme Court missed an opportunity. Gyms, fitness, pools, recreational facilities, this does not impact school because school is in the different order, and it's also governed by the KHSAA, and it's governed by other directives that are listed on the page if you want to read about it. But other than schools, all gyms, indoor facilities, exercise, and so on are limited to 33% of maximum capacity, 6-foot distance, no group activities, no basketball, no cycling classes, no other opportunities to have anybody together. It's all individual activities. I don't know what that means for like trainer-trainee, individual one-on-one. They have not defined what group is. It just says no group activities. Masks are mandatory. They were not in the past, but they must be worn at all times, regardless of what the strenuous activities are that are being engaged in. Event venues, theaters, indoor venues, event spaces, weddings, funerals, etc., 25 people total. Doesn't matter how big the room is. There have been some challenges to this particular directive because it does not identify the amount of people in a room. If the room is a massive, let's say, rep arena, you're limited to 25 people. Unless, of course, you're running a basketball program, then you're limited to 15% capacity. Rep arena with UK, the Yum Center with Louisville, other programs, they're limited to 15% capacity, or their whatever their SEC, ACC, whatever limitations are being put on that. The problem is that you're going to be challenged with this 25. I also suspect there are challenges from gyms, because if you can allow 25 people together, why can't you have groups together with social distancing? But it is what it is. This does not apply to places of worship. It directs you back to the Healthy at Work, but the Healthy at Work for worship locations hasn't been updated since, I think, July, so there's no real governing information there that tells us how that's going to be handled. For most of you on this last one is the one you need to pay attention to, which is the professional services. Any business that is a professional business now is limited to 33%. Before last Wednesday, you were limited to 50%. Also, you must allow work from home unless there is no ability to work from home. Let me repeat that. Under an executive order from the governor, you must allow work from home unless you can demonstrate that there is an inability to do that, and then you must be limited to 33% of your employee task force in any professional setting. This did not address factories. This did not address any of the other entities. I expect we're going to see a whole bunch of individual executive orders or updates to the Healthy at Work website. I've been checking it. The good news is this. Wednesday, Thursday, part of Friday, the Healthy at Work website and the KY COVID-19 at ky.gov websites were completely not updated. The governor's office did a substantial amount of work to improve that, and it is now updated. All of this information is on the website. Also, for those that need to know it, there is another, let me put this up there so you can see it. There is on our website executive orders, in their website, at the KY COVID. If you go to the governor's page, this is all brand new as of yesterday and the day before. There's a mask coverings mandate that came out at the beginning of November. It's now on there. Price gouging is prohibited. So if you see it, you can report it. There's an executive order on dispensing of pharmaceuticals during a pandemic, and that's on there. There's also an executive order on utility relief. And then, of course, like I said, we're walking through it, the executive order effective Friday through Sunday, the 13th of December that we're talking about right now. And also the executive order that is effective today for schools that we're getting ready to talk about. So let me walk back through these. I think I skipped a page and I want to talk about it for a second. So,
real quick, are there any penalties associated with this, or what are the consequences if businesses don't adhere to the executive order?
Yeah, that's really an interesting question. It's part of what led to the first appeal to the Supreme Court. Basically, the penalties are that you can be arrested, you can be cited. The sheriff and police departments have authority to enforce the executive order, and these are unlimited. So I don't know what the penalty will be because it doesn't spell out in the executive order itself what those penalties are. So, for example, if you look at, let me see, did I pull up the wrong page? Give me a second to pull it back up. Sorry, I had closed out of the page, and now I've lost that page. There it is. No, wrong one. Sorry. Legal work. No, it's not there. So I lost the page. I'll find it here in a minute at the end. The executive order does not walk through what precisely happens if you violate, but we have had certain sheriffs that have said, I don't plan to bust down the doors of people's houses if they are having 3 families together or 10 people are at Thanksgiving. But it is a violation of law, and the Supreme Court has said that at least right now he has the authority to do that. I do suspect the Supreme Court will be involved again because, as I told you last Monday, all they did was punt. They literally said, oh, we changed some of these before it came to us, so they're moot. We don't need to address it. Well, now these are all back in effect. We've got some issues. So Wednesday, Supreme Court issued its ruling a week ago, and now Wednesday, the 18th of November, Governor issued its order. I know I'm going backwards, but I want to tell you some things, and when I realized I skipped it, I wanted to talk about it for a second. Business mandate went into effect last Friday at 5 o'clock. The school mandate went into effect this morning, all day long, starting at midnight. They were required to take action last Thursday to notify people, but it went into effect today. Executive order identifies additional information is available on the website. The website is up to date somewhat. There are some things that I'm hoping they'll tweak, but overall it's a lot better than it was. Each of the executive orders talk about the authority granted, and they use the Supreme Court. So it relies upon the Supreme Court basically saying shame on the legislature. It relies on the potentially catastrophic surge in 19 cases with COVID-19, which is the critical word he had to use. And it talks about the need for new health measures because nobody was following the red zone reduction recommendations. So based upon the fact that the red zone reduction recommendations either weren't followed or didn't curb the damage to or the potential health crisis, Governor came out and issued these. Here's my political comment for the day. Very frustrated at the Kentucky Supreme Court because of this. And yes, I'm an attorney. Yes, I'll probably get backlash on that. But these cases were filed in April and May. Challenging the governor's orders. The federal courts had ruled that the governor's orders were unconstitutional. The state courts almost unanimously ruled that they were unconstitutional. They pointed out that the legislature is the only one that can write law. The Supreme Court said either, wait, well, he changed this after the appeal, so we don't need to look at it, or, you know what, the legislature was really foolish and didn't do its job in limiting the governor during an expanded emergency, but this is an emergency. It's been declared an emergency, so shame on the legislature for giving him this authority, but it basically allowed him to be judge, jury, and executioner, or in terms of government, he can legislate with his executive orders. He can be the judge of these because he doesn't have to worry about judicial oversight, and of course, he is the executive branch, so he can execute on his own orders during an emergency. My frustration with the Supreme Court is this. This was issued in May. Actions were taken to appeal it in May. The governor was told you don't have authority in May. Went up to the Supreme Court and they said, oh, let's have oral argument. We'll schedule it for September. Okay, so I told you starting in September. I expect an order any day. I expect an order any day. I expect an order any week. I think we're going to get the order. Why? Because we're in the middle of a pandemic. We've got a governor who thinks he can do things, a legislature who says he can't, and judges who say he can't. But the Supreme Court said, for right now, let's leave this status quo. We're not going to change anything. His orders are in effect. Governor wouldn't issue any more orders because he was waiting on the Supreme Court to rule. The Supreme Court could have done two things. One, issue the order quicker, get the oral argument quicker, and come out with it. It's 103 pages, but it basically says, here's all the history, here's what the legislature could have done, here's all this stuff. We really didn't need that in the middle of an emergency. What we needed was up or down. Can he do this? Can he not do it? Our Supreme Court sat on that until November in a pandemic. So our governor didn't do anything, waiting on the Supreme Court. Now we're in the middle of a crisis. The governor waited until he had authority. I blame the Supreme Court. I think the governor should have come out quicker too, but he's sitting on it because of the Supreme Court. So I'm very frustrated, disappointed, because these are people's livelihoods, these are people's businesses, and these are people's lives at risk. And everybody sat on their hands waiting for somebody else to do something, and now the Supreme Court's like, well, he could have issued more orders. Well, yeah, but he's waiting on them. Everybody's waiting on them because every court that addressed this before they did said this was wrong. Then they come out and say, well, yeah, but he can do whatever he wants because the legislature was dumb enough to put it in there and it's their fault, not his. Okay. So where we are legally is legislature has to rule on this, but the legislature can't be called into session unless the governor calls them into session, and the governor has control of everything, so he's not calling them into session because they have veto-proof ability to change his status. They don't come into session until January 4th. They will not be called in by the governor because he can do whatever he wants right now because the Supreme Court said, you do what you do. So that's where we are. I've told you about this, the business executive order. Let me tell you about the school. We're almost to the point of walking you through reminders on this, but I just want to let you know, oh, sorry. The restaurants and bars, he's set aside $10,000 per business, or 20 if you have more than one location. That $20,000 is not available if more than 50% of your, or the $10,000 not available if more than 50% of your revenue comes from drive-through. I don't know what they're going to do about the fact that everybody's business right now comes from drive-through. So what's the time period we're looking at? We don't know. The application hasn't been put on the website. They say the applications are going to be accepted starting November 30th through, I think it was December the 13th. It is first come, first serve. I would be refreshing your page every morning, every night, checking it. If this applies to you, you have to make sure to apply quickly because $10,000 per, there's $40 million available. I don't know how many businesses are going to be able to try to challenge this and apply for it, but it's every restaurant, every bar, every food location, every vendor, trucks, street side, doesn't matter. They're available for up to $10,000 for, quote, various expenses. We don't know what those include. We also don't know, it doesn't include publicly traded. They're trying to get rid of Starbucks, McDonald's, Burger King, all those. You must comply with all public health orders in order to receive the money, and the details will be forthcoming. I don't have any other information. One other thing they did for restaurants on November 5th, I didn't talk about this before, I didn't see it. It popped up on their website this weekend. ABC commenced a 12-month waiver of renewal fees for beverage licenses. That's your beer, wine, alcohol, those types of things. So they've expanded that to let you have additional monies, and that was talked about in the executive order, so I threw that in there. All right, schools and families. So we've talked about the FCRA in the past, so I want to make sure you all understood that's back in play. Our executive order from the governor applies to, quote, all public and private elementary, middle, and high schools, does not apply to colleges, not yet. To colleges, trade schools, other educational institutions. It also expressly says it does not apply to in-home. So if you're doing in-home schooling, it doesn't apply to you at all, as long as you're not exceeding one family, one household. All schools must cease in-home in-school education starting today. All high school and middle must remain remote until January 4th. Elementary may go back starting December 7th. However, that depends on whether you're in a red zone based upon the picture I showed you. And based upon that picture, none of you are going back unless things change, and I just don't see that right now. All schools must follow the Kentucky Department of Education. That's on the KY Healthy at School website. That has also been updated, so I'm thrilled about that. If you have questions about this, you can still look into that. It talks about you do have the ability for, quote, small group in-person targeted services. It does not define what that is. Does not apply, as I said, to in-home schooling of household members. It does apply if you have multiple people in one house. So, additional guidance is available on the website. How does this impact businesses? Why am I talking about this? Well, you'll remember, and I'm sorry this is doing this in this fashion. I didn't mean to have it popping up one at a time. So I'm going to put them all out there. Whoops, wrong page. Sorry. All right. We talked about the FCRA previously. FCRA applies if there's a quarantine or isolation order. Guess what? We're in a quarantine and isolation order under 2020-968, which is the business-oriented limitations. If they're advised to self-quarantine, yes, we're under that as well. If they're experiencing symptoms, that doesn't apply to the executive orders of the governor. If they're caring for an individual who is subject to an order under 1 or 2, the entire state is subject to an order under 1 or 2. And obviously 5 and 7 also apply because, and that's why they're bolded here, if they're caring for a child whose school or place of care is closed, you'll remember virtual equals closed because the children have to be watched. So if the school is physically closed and is only doing virtual, then the FCRA applies and you have to provide time off to them under the FMLEA, the FMLA, the FMLEA. They're called different things, so you have to keep that in mind. They get 12 weeks every year, rolling 52-week period. That's critical here because all of you, almost all, had school-related shutdown in the spring. You need to be looking at adding those together because employees only get 12. This is why you'll remember I was sarcastic over the summer and I talked about people going on vacation because they found some kind of camp that was closed and said, oh no, my kid was going to go to the archery horseback riding camp in Saskatchewan that's closed, can't get across the border, so now I need next week off, and then they went on vacation. Well, it may have been fun in the summer, but now you add up the time period, and if that employee's out of time, that employee's out of time. They don't get any extra time. They get 12 weeks per rolling 52. So I know we're running close on time. I do need to walk you through a couple of other things. This one, expanded leave, if they are caring for a child whose school is closed. So how do we do all of this? How do we talk about this? We talked about this before. Look back at what we talked about, okay? Department of Labor and IRS talk about you will get reimbursement, but you only get reimbursement if employers properly document. You get a dollar-for-dollar reimbursement for FCRA. So look into that. That drastically impacts you. This is not supposed to be an impact on you for employees to get time off to take care of their families. So make sure you look into that. The information is on our website. We've had this information on this in this webinar in the past. The other thing is this. You must maintain proper calculation. They only get 12 weeks. If you screw up, the government's not going to give you 13, 14, 15 weeks. You're only getting reimbursed for the 12. It's not in addition to. It's only another method to receive leave. Develop and update your appropriate policies. My biggest recommendation to you is allow your employees flex time while they're working from home to care for their children. Otherwise, you have to allow them this FMLA leave to take care of their child because they are working from home, or I'm sorry, they are at home. So if you don't allow them to work from home with children present, you're burning through that leave. We talked about this at the end of July with regard to back to school. I thought people were going to start burning through their time. This now is the same exact thing. So if you really want to hear the in-depth discussion of the FMLA leave, the FFCRA, the CARES Act, all the interplay, we talked about what this means. I think it was on July 25th. I talked to you in depth for almost an hour about how we get people back into school. But these are things you need to rethink about. Working from home, OSHA. Remember, it's your obligation, even though it's their house, to have a safe work environment for every employee. Allow your employees to have flex time. Allow them to have a shift change with their spouse. If you can allow people to work overnight or jumping so that they're training their child during the day and then working at night, allow all of that if you can. If you can't, then you've got to calculate and count out very carefully the 12 weeks of leave, the 2/3, the full pay, all the different things, up to $200, up to $600. We talked about the details. I'm not going to go through it at this time because we don't have the time. So these are the hit me with the frequently asked question, or the questions that popped up, because obviously I haven't been able to read them.
Hey, I don't want to feel too bad about running long. We thought we could do it faster, but there's a lot to cover. So Jim, you just stick with it and let's get these questions answered and hope people are with us.
All right, so we've got, with health departments no longer contact tracing, we're finding that we as the employer are asking employees to quarantine as a result of our contact tracing rather than an order from the health department. What type of documentation should we keep for the FFCRA related to that?
So if you have documentation of a substantially legitimate need, you've done your own tracing, and I'm intimately familiar with the problems with the contact tracing. Fayette County's still trying to do it, but by the time they got around to the person that tested positive in my family, they'd already been quarantining for 8 days with a negative test every day. So it was like, so why are you calling? Well, we need you to sign a contract. Well, I get to go back 2 days from now. Why am I signing a contract? Well, because we're doing contact tracing. And the response back was, you're 8 days late. How in the world are you doing this? And they're so far behind. So Rachel, the reality is this. If you do your own tracing, which you are responsible for doing under the Healthy at Work officer, under the governor's May 11th directive, you're doing your own tracing. You realize that somebody has in fact been in contact with someone else. Document that fact. When and if you get challenged, I seriously doubt the IRS is going to challenge a single employer because they're going to be inundated with this dollar for dollar refund. Quite frankly, if you're running a business right now, the government's thrilled that you're actually doing it right. I don't think you're going to be challenged. Document. We had a contact issue. We put the person on quarantine. We asked them to get tested. We followed the CDC guidelines for contact tracing. There was no local tracing available. Make sure HR has that. Put it in the red file to be careful because this is health related, especially for the person that had it. Maybe not for the people that were in the contact tracing, but the person that tested positive. Remember, we talked about this in detail. Go back and look at it. If Brad Patrick tests positive, I'm not going to go out and say Brad Patrick tested positive, Lyle, so we need to have a discussion. You and Troy were in a meeting with him. Can't do that. All I can say is, look, you were in a meeting on Monday in person, and we have reason to believe that someone may have tested positive, so we need you to leave immediately and self-quarantine, go get tested, go see your doctor. You can't say Brad Patrick's name, okay? Because if you do, you're violating other HIPAA violations because this is an illness and you're not at liberty to share that information without permission from the employee. Keep that in mind. So we've talked at length about some of these, so go back through and thank you, Allen County. Brad, thanks. That's the third county listed. I could not read it. It was blurry and I was trying to do this. So go ahead with the next question.
Okay.
So we're going to stay on here until all the questions are answered. This is not for credit, so if you want to ask away, If I don't, the one caveat, as always, if I don't have the answer, I'll either try to get it and we'll do a global email, or I'll just have to say I have no clue because we haven't gotten that far with the governor's orders. This is all brand new, hot off the presses. So go ahead, Allison.
Okay, great. And I've reorganized them. So if someone doesn't hear their question, I've tried to group them by if it's about FFCRA or if it's about the governor's mandate. So don't think we're skipping you. But so question about professional services. An employer only has 2 employees. Does this mean nobody can go into the office to collect mail, etc.?
Because it's less than 33%. So hypothetically speaking, Lyle and I had quite a few discussions this weekend, text messages. One of the issues when you rush out an executive order is should say in a facility that has at least 5 people or 3 people, no more than such and such percentage can be in the building at one time. Obviously, with 2 people, you never get below the 33%. My recommendation there is only 1 person in the office at a time, unless, of course, you all live together, if you're husband and wife or things like that. Obviously different because you're all in one family. But if you have multiple families or you have groups like that, you need to be thinking more along the lines of 50-50, 1 person. The other person can't come in. You can alternate. 1 person gets the mail one day, wipes everything down when they leave. The next person gets the mail the next day, wipes everything down when they leave. Some of this is going to be common sense. Yes, you have an executive order that can't cover every aspect. Otherwise, it would be a statute. The governor is not in the business of writing laws. So the executive order does not cover things like the legislature typically does. There's literally say, for example, discrimination. Business counts if it's, 8 or more employees, then this law counts. 12 or more, this law counts. It doesn't apply to people who only have 3 people in their business. This one didn't say that. It's probably implied. If you have 3 people, only 1 in the office. If you have 2 people, obviously no more than 1. But that's what was probably intended. But use your common sense judgment on this because some of these things just haven't been fleshed out yet. Hopefully they will be in the coming days.
Great.
Next.
Okay. So if we only have 15 to 20% capacity in our office, should those who can work from home, are those who can work from home still required to do so, even though they work in a private office? This question is specifically referring to business presidents who are choosing to work in the office.
All right. So the reality is no. You are. Now, if you're at 15% capacity, then you're below the 33%. But you talked about having it set up for 15 to 20%. Must they do it? The order is anyone who can do their job. There's 2 parts to this order. First, anyone who can do their job at home must be allowed to work from home. If you can't do your job from home, you must have a limitation of no more than 1/3. So there are 2 different mandates in that one directive. So what you're saying is, well, we're at 15%, so everybody can come in. Well, you're ignoring the other mandate, which is if anybody can do their work from home, they must be allowed to work from home, period. Number 2, if they can't do their work from home, then you're limited to 1/3 capacity of your overall, that's a 6-foot social distancing, etc. So they're doing this in 2 phases, or 2 parts to that directive. You have to comply with both. So your first question is, can they do their job from home? If John Green can do his job from home and he doesn't have to be there, then we have to let John Green work from home and we have to tell him to work from home. If he comes back and says, there's no way I can work from home because I have to oversee whatever, then John Green can be exempt from the must work from home, but John Green still falls into the 33% capacity. So you have to go through every person with both of these questions, not one or the other. Sorry to pick on you, John. I know that you don't mind that type of example. I didn't want to pick on Brad the whole time.
Great. Okay, so we've got a question. I work for a manufacturing company and the majority of our team works in production. Does the work from home mandate apply to our office team?
You know, that's the part that I said that we don't have any guidance yet for factories. That's the concern I have with the executive order. The executive order talks not in terms of essential and non-essential, which is what he did in April, but now he talks about professional restaurant and bars. I'm going to move back. We don't need the question and answer screen. I'm going to show you that page. The order literally talks about these. It only talked about these. It didn't talk about anything else. Literally talked about restaurants and bars, social gatherings, gyms, fitness, pools, recreational facilities, event venues, and professional services. So my big question on that was, what about manufacturers? What about Kroger? No, I'm not picking. I'm asking literally Kroger, mom and pop grocery store, Marshall's department store, Target, Walmart. Pick it. I don't care which one you want to look at. The problem is we don't have any guidance on the rest of the facilities. So to answer your question, technically speaking, right now, I expect this to change. I think we'll get Executive Order 370 or whatever number we're on. Technically speaking, factories don't fall under any of these orders. However, do your front offices? I would say the front offices probably do. Now, the majority, to read from Judy's comment, quote, the majority of our team works in production. The production can't work from home. It doesn't order, it literally says professional services must mandate work from home. If the office remains open, this doesn't talk about factories. So I don't know how to direct you other than I would think your front office are professionals. That is a professional services. You may fall under the 33%, have people work from home if they can. If they're on the production floor, then you're into the 1/3 facility. I don't know how they're going to do factories. Factories, the interesting thing for me is factories like the chicken processing plants in Western Kentucky. They have been a hotbed. It went through people are living in a communal household. They have apartments set up. It went through there like wildfire. A lot of these were Hispanic workers from under a visa program, and it went through their whole system like wildfire. But this doesn't address those. It doesn't address nursing homes. It doesn't address some of the things that I think probably could and should have been addressed and will in the future. But I would be very careful with your front office. I would treat that more like the professional services or the event venues than I would say, hey, there's no order out there, so we can just keep going, because your employees may try to challenge you on that. So be careful. Next.
All right, so we're going to switch gears, and we've got some FCRA questions here. Can you pay an exempt employee at 2/3 for intermittent EFMLA hours due to assisting children in virtual learning since schools are closed?
So that gets really, really technical, and I'm going to give you a vague yes, but you probably need to talk to either an HR specialist or an attorney, probably an attorney, simply because interpreting the EFMLEA extension of FMLA on intermittent is very complicated. Whoops, I want to stay on that page for a second. Actually, no, I want to escape that for a second. I want to go to this one. Give me a second. So I would get information from an attorney on that, or a little hint, go back. It's on our website. It's also on the HANA website. When we talked about this in detail, I talked about when intermittent leave would be available under the EFMLEA and the FCRA, the CARES Act, et cetera, and when it would not. So you can probably get a lot of your guidance off of that, but individual situations need to be individually answered. And Rebecca talking about Jenny's question, I also put it on the page. So it's literally right here. This is from the governor's page. The professional services limited to 33%. And then also the executive order right here talks about it. And this is the actual order itself, not an interpretation of the order. and it talks about under the professional services. This is the actual order signed by the governor into law as of November 18th. It says any office that remains open must ensure that no more than 33% of employees are physically present in the office any given day. Except for the two-person office, I think you understand that, one person only in the office. Next.
All right. Do employers have to pay the emergency sick leave for employees who must quarantine ahead of a scheduled medical procedure that is not related to the pandemic?
It is related to the pandemic, beyond the pandemic, because it is actually a medical order as a result of the pandemic to quarantine before a medical procedure. So this would be the same as if somebody was pregnant and required to go into the hospital because of bed rest before they have a C-section. Simply because they didn't have the C-section on day one, they're still required to not work for the 2 days before the C-section. So this is related to COVID, but more than that, it's related to the basic FMLA leave. You have a medical procedure that's going to be done, performed by a doctor. The doctor has literally said, Brad Patrick must quarantine for 48 hours before he has the medical procedure. So that documentation from the doctor makes it so that Brad can't come into the office. However, if you have the ability to have them work from home, that's your way around. And that's your way to get through forcing Brad to work from home because he can quarantine and still use his computer. So if you can do that and have him work from home, that's your best bet. Yes, the 25-person limit does apply to funerals and weddings. Does not matter whether they're indoor or outdoor. You are limited to 25 people, period.
Okay. For employers with more than 500 associates, can associates apply for unemployment for COVID-19 related reasons? My understanding is that we do not apply to the CARES Act and do not have to pay. I'm assuming that means pay FFCRA, but was recently told that has changed.
The FFCRA has changed depending on the type of business that you run. It depends on your particular as to whether it applies to you with over 500, but there are other rules that apply to businesses with over 500. We talked at length about that in April and May. Go back and take a look at those because they have not changed since then, to the best of my knowledge. However, they can't apply for unemployment unless you lay them off. And I did have, actually I had a legal case this week that was a little funny because the judge's comment was, well, now wait a minute, to me, in a case, this doesn't say that this person was fired. It's not like they did something wrong. It literally says that they were laid off. And I said, Judge, with all due respect, Kentucky unemployment law says this person was terminated, whether they're fired, laid off, hit the road, furloughed, the word doesn't matter. If there is a separation in employment at all, they're entitled to unemployment. That means that they're no longer governed by whatever relationship they had with the employer in the past. They've been terminated. So to answer your question, they can apply for unemployment if you have fired them. If you're asking about the extra money, there is no extra money. The $600 from the government, from the federal government, is gone. And they have not implemented a new. I think Kentucky had an expanded one, but if I'm not mistaken, it shut down in the middle of November. Don't quote me on that. But if they're just going for unemployment, they just apply for unemployment. There is no more federal. That's what we're trying to get the next CARES Act, the next whatever you, HEROES Act, whatever you want to call it. We're trying to get that implemented from the federal government, but they haven't done it yet.
So I'm going to try to rephrase this one a little. So it sounds like the question is, if my child has a COVID test for symptoms, but the test comes back negative and it's just a sinus infection, would the employee still be eligible for emergency sick leave?
Yes. So if the person is quarantining at the guidance of the doctor before the test comes back, or if there's a reasonable belief from the treating medical care provider that that child could or may have COVID, Or if you go back and look at what we talked about, I'm not going to pull it back on the screen, but if the person is reasonably quarantining while waiting for the test to come back, they are entitled to leave. That's the leave that the federal government will pay you back for. So if you're on leave because your child may have COVID and you're waiting on the test results, most of those test results are back in a 24-hour period or less in the state of Kentucky, so it shouldn't be an extended period. If you're outside of the state, check with your state, but I know like UK was on an 8-hour turnaround on testing. I know Wildcare in the central Kentucky area, which is a combination with UK drive-through up into your brain testing, it's on an 8 to 12 hour, but they say up to 3 days just in case. But if that person is getting a test for the child and has been recommended to quarantine while they wait for the results, they are entitled to leave.
Okay, and then we've got one last question. If I understand, they left out essential versus non-essential. I'm assuming this is relating to the governor's order. So it appears the question of can they work from home is defined rather loosely. Is that correct?
It is defined rather loosely, and that's what you get with executive orders. Like I said, legislature, if you look at the statutes for any of this, they'll have if this, then this, then this, then this, and it's subparagraph. I mean, this would have been spelled out with all of the potentials and the infighting between people to come up with it. They don't have that with an executive order. There's been no challenge addressed to it. So some of this is way behind in terms of how to really implement this. So yes, it's very loosely defined, but if there's any way for anybody to work from home, you must allow them to do so. One comment from Neely about the drive-through. I agree with one problem though. What time period is the governor looking at? Because he says, just so everybody knows, it says the question was asked of the governor, what does it mean if it's everyone's drive-through now? And he said, oh, it would be whatever it is pre-revenue. But for what time? Pre-order for revenue. What time period? Because most of these started drive-through in May, June, and July when they were allowed to open. And they've been drive-through because they only have a third or 50% capacity. So like Puccini's in Hamburg, I happened to see them yesterday. No, I didn't eat there, so it's not the restaurant I was talking about. They had everybody lined up to pick up drive-through. They've had that since this pandemic started. So what time period are we looking at? Is it 2019 revenue drive-through? They had 0. If it's the last 6 months, every restaurant in existence from Malone's in Lexington, I'm not calling anything else, Malone's, Drake's, Puccini's, Five Guys, everybody's doing drive-through and delivery or pickup. So technically speaking, every business may have near 50%. So the question isn't whether it was pre-order, it's what time period pre-order, the last month, last 3 months, last 6 months, or are we looking at 2019 revenue? Because some of these businesses went to a drive-through, quasi-drive-through model as soon as the pandemic started so that they could at least exist. So that's the issue. We don't have the answer yet. The application's not out. Next.
I think that we have hit them all.
Hey,
All right. So, guys, it's a new world. This is really, really crazy. I expect we're going to get a lot more over the Thanksgiving holiday. I suspect we will have federal relief monies being made available, but please run your businesses carefully. Check the website from the kycovid19.gov. Personally, if you're going to have a group gathering over Thanksgiving that's going to exceed the 8 people, be careful. Don't talk about it out there because technically speaking right now, you can be arrested because our Supreme Court has not weighed in on that. It's not the governor's fault. Governor's doing what the Supreme Court says he can do until they tell me he can't do it. So until January 4th, when the legislature steps in and takes away whatever authority, this is the authority, and be careful about what you're doing. That's all I got.
Good work, Jim. You want to drop the slides and let's see if anybody wants to hang around and talk for a minute.